Hey everyone, this is my blog post for week 3. After reading chapter 7 in our textbook and taking the leadership quiz, I found that I was kind of split in between the administrative and conceptual styles of leadership, and scored high in the high range for both of those. In reading our textbook, the skills that I think would be most beneficial to be able to secure resources such as staff or things my staff may need would definitely be planning, both short-term, strategic, and long-term. Or I guess that would be all three, all in separate ways. Short-term would just be making sure that the day-to-day things the staff needs or temporary staff I could get. Another one would be the strategic and kind of long-range planning, kind of going hand in hand, and just how we were retaining staff and making sure that if we know a staff member is leaving, maybe we have another staff member that's already orienting and trying to get used to the unit. At where I work right now, we are actually opening a second building. So if I were in a leadership position, I would definitely consider going ahead and thinking, kind of planning for the future of starting to hire more nurses and get them oriented to the unit, just so when that new building opens, we have staff to adequately staff it and not strain the staff we currently have now in the old building, I guess you could say. And just kind of plan ahead for that so that they're, getting used to the unit, getting used to how we do things, and once the new building opens, we're not scrambling to try to create staff for that. And then that way they'd be comfortable and knowledgeable in order to provide care for our patients. Another skill I think is really important is definitely communication. I feel like you have to be a good communicator as a leader, not only to your staff, but also if you are trying to get resources like more staff or budgeting or, other resources you may need on a day-to-day basis. I feel like you have to be a good communicator to say exactly what you need, help them understand why you need it, have the data that supports why you need that extra nurse on a weekend or why you need the extra tech during the week, whatever it may be. Staffing, of course, goes along with that I feel like a lot of times nurses get burned out fairly quickly because of inadequate staff. I know that was kind of my situation when I worked inpatient. I felt like I was getting burned out even after only being a nurse for less than a year. But I feel like making sure your staff are adequately staffed, and if not, trying to problem solve to figure out how they can be better staffed or how you can kind of help them out for that day, or whatever it may be, offer incentive, or even as a supervisor or leadership position, maybe come in and help for a couple hours just to get them through that tough time. The last skill I think is important is definitely organization. I feel like a lot of times there can be little things that get missed or fall through the cracks, and that can kind of affect the flow of the day or the week, the month for your unit. I feel like as a leader, you need to be organized in order to know exactly what needs to be done and when, and have a to-do list of this is everything I need to do today or this week, this month, whatever it may be, so that you can keep track of everything and nothing gets missed. The article that I found for this blog post was titled "The Transdisciplinary Coordination and Delivery of Care." It basically looked at oncology patients, which is the field I currently work in now. But it looked at their healthcare team and all the different parts of the healthcare team and how each discipline, whether a nurse, an educator, administrator, physician, whatever it may be, they use their own evidence-based practice, and as a team, they come up with the care plan for the patient that all has the same common goal. This way, they're all on the same page. There's no redundancy. There's, no miscommunication about what the main goal is. I feel like this is important just so that the patients can get the best care provided. The levels that I feel like I would have to interact with to be able to get the resources I need and be effective in my role would definitely be the supervisors I would have if I was the manager on a unit. The place where I currently work now, we have a manager, and then under her we have 4 clinical supervisors, and they're kind of day-to-day on the floor constantly. But even then, I would feel like it'd be really beneficial to work with the manager's manager, which she's kind of the director of all the managers at the place where I currently work now, and she kind of oversees day-to-day activity for them, and if there's issues, she, they go to her and try to work everything out. Another person would be the AVP of LCI. She kind of works hand in hand with the president of LCI and is kind of right under him. So working with those two to just keep them up to date on issues or concerns or wins, positive things on the unit, anything like that. Needs that might need to be needed on the unit, and then from there work together with them to figure out, how can we move some money around in the budget, or how can we get this and what can we cut out, and those sort of things, just to be able to get the resources, not only staff, but resources that staff may need on a day-to-day basis to do their job. And lastly, I feel like if I had to choose between horizontal and a vertical structure after reading in our textbook on page 154, I would prefer the horizontal structure just to promote effective and efficient performances of the staff. At LCI, there's a whole bunch of clinics, radiation oncology, radiology, infusion, labs, all sorts of groups of people that work together just to provide adequate care for our patients on a day-to-day basis and keep their day working smoothly. As far as the model I would want to use, I definitely think team nursing is a great model to use. We currently use that at LCI now, and I just feel like it really just promotes teamwork and it brings the unit together. It prevents newer nurses from being completely overwhelmed, prevents, other nurses from having to take heavy patient after heavy patient, but at the same time, if you're just getting single regimen chemos all day, then you can just keep taking patients as you feel comfortable. I feel like it's really beneficial, as I said earlier, just to not overwhelm nurses, and to provide really great care and give them the time that they need to sit and talk to their patients and get to know them, and, take the time without having to take the next patient right after that, which I think our patients really appreciate the time we take to get to know them and sit with them and everything like that. So thanks for listening to this blog post.